Have you heard people saying so many people have COVID right now? Well, the CDC numbers have spiked. Reaction to more cases isn't like it used to be. I talked to a doctor and a long COVID patient on how we should approach this recent surge.
I'm really starting to feel, back to normal. I don't want to do all this again.
Nicole Nashenzi spent months dealing with debilitating long COVID symptoms. After pulmonary rehab and medication, her symptoms are now rare, only when fatigued. But she certainly doesn't like hearing the COVID uptick coming back into conversation, especially with an emerging Eris variant.
We don't know if the tools that we have, the vaccines or the new booster that's coming out in the fall or Paxlovid, we don't know if those are going to be effective. And we don't know how fast this one is going to spread and what this one might do. So it is concerning.
While there isn't an Eris-specific vaccine, experts are confident the upcoming booster out this fall will offer some level of protection. And while the CDC hospitalization numbers show a 21.5% increase in hospital admissions nationwide, the numbers are still far from any pandemic-era hospitalizations. The report shows the number of people hospitalized with COVID in Oklahoma at 95. Infectious disease doctor Anuj Malik says he's seen a slight uptick in COVID patients at St. John, mainly outpatient. He says the vulnerable groups with compromised immune systems are still the most concerning, and that some cancer and MS patients have to be particularly careful.
These poor folks get in trouble because of medicines that they take, which are great for the disease, but really impair the immune system.
Dr. Malik believes people in those groups are the main ones to consider masking right now.
I think when they go indoors, where they're going to be there for a substantial period of time, the activity in the area is high, they should mask. But I don't think everybody needs to mask.
Dr. Malik and Nashenzi urge people with symptoms to get tested.
Some people are playing that, is this allergies or is this COVID game? So since there is a spike, you might want to reach for a test sooner than you might have a few weeks ago.
Testing for COVID could prevent giving it to someone at higher risk. The CDC recommends staying at home at least 5 days if you test positive for COVID and try to separate yourself from others in the house.